So I will not talk about maybe line of treatment in dental office, but mainly more first aid and how they should to manage to this type of injuries. First of all, have no relevant financial relationship to disclose. My learning objectives is to explain the role of sports dentistry in the field, define types of oral injuries, why an immediate response is important in oral injuries. First of all, I need to define sports dentistry. Sports dentistry is the branch of sports medicine that deals with the preventions and treatment of dental injuries and related oral diseases associated with sports and exercise. But who's a sports dentist? Sports dentist team, they are a specialized team of healthcare professionals that assist athletes in diagnosis, treatment, and preventions of oral injuries. And what is our responsibilities for our athletes? We have to do a screening to detect any oral problems, providing all necessary preventive treatment, being available for emergency trauma care, recommending and fabricating custom-fitted mouth guards, and also assist our colleagues from clubs and federations, doctors, on how to deal with oral injuries on the field by using our kit. Okay, this is our dental emergency kit with the materials inside it, and also there is a booklet inside it. It can explain to them how to use the materials or the instrument step by step. The question is, what's the difference between a general dentist and a sports dentist? The general dentist focus on the overall dental needs of a patient. This could vary from their level of oral hygiene care to dental filling and crowns. However, the sports dentist focus mainly on the relationship between oral injuries and dental problems that might affect the athlete's performance, as well as preventive methods such as mouth guards. And this can be monitored and maintained through a dental screening process and a regular checkup, also encouraging consistent appointment attendance. Dental screening process. I think we are the only center here in Qatar which provide screening or regular checkup for our patients. Every year we do a screening for our athletes at least one time. As I mentioned before, one of our responsibilities is to do dental screening for our athletes. And the screening process includes oral examinations and also a medical history review, plus intraoral and extraoral dental examinations. As there is many of dental problems can be asymptomatics. Therefore, without oral examinations and the dental x-rays, the athletes could be at risk of further complications. There is also one article published directly after the Olympic Games in London. It shows the importance of oral health. As concluded in the article, the oral health is an important element of overall health and well-being. Health promotions and disease preventions interventions are urgently required to optimize athletic performance. Also, recently we published an article to show the oral hygiene level here for our athletes. What we have done here in our department, we screened 1,079 athletes and we divided them into 4 groups. Arabic, Asian, black, and white. The majority of them, it was almost 92% males and almost 80 females. And the average ages, it was between almost 15 to 29 years old. What we found from our screening, so we screened 582 Arabic athletes in our hospital. Only 56 patients needs no dental fillings. It's a huge number. 132 require 1 to 3 teeth needs require teeth with the decay, which needs dental fillings. 155 4 to 6 teeth with the decay, and then 108 7 to 9 teeth with the decay, and so on. Also, 120 teeth require 1 to 3 teeth require root canal treatment. 120. 17 from our athletes, they have 4 to 6 teeth requiring root canal treatment. And also you can see a rate of the periapical infections. How is it high? Broken teeth and impactions, tooth require extractions, and so on. I think this study, it gives us really a big alarm about our athletes. They are really at high risk of injury if they receive any types of trauma. And of course, that might affect their performance. I'll show you also maybe 1 or 2 X-rays was done here in our screening department. This is panoramic X-ray was taken for one basketball player. The case was completely asymptomatic. Once we took X-ray, we found odontogenic cyst with impactions 4-7 and 4-8. Another X-ray was taken for one football player a few months before, and the case also again was asymptomatic. What we found again, a huge odontogenic cyst with mobility in the lower anterior teeth. The question is, what are the different types of oral injuries? There is types related to soft tissue. And as you know, the face is often the most exposed part of the body in athletic competitions. And any injuries to soft tissue of the face are frequent. And this includes the lip, the gums, and the chin, and so on. There is also injuries related to hard tissue structures, which this include the bone, the jaws, and the teeth. So, if the athletes receive the trauma in the upper jaw, or what you can expect from him? I mean, what's the symptoms? This is, for example, an CT scan was taken here in our radiology department for one football player received a trauma during his competitions. And we found the complex zygomatic fracture, including an infraorbital and the frontal process plus zygomatic arch. The symptoms, flatness of maxilla, diplopia or double visions. Sometimes there is blood inside of the eye, pain during the mouth opening, swelling, inability to bring the teeth together, and also sometimes inability to close the mouth properly. Another panoramic X-ray was taken in our department for handball player. It shows also a fracture in the midline of lower jaw. And the symptoms here, bleeding from the mouth, difficult opening the mouth, and facial swelling, jaw stiffness, jaw tenderness or pain, and will increase during the mouth opening. Also loss or mobility of the teeth, abnormal appearance of the jaw, numbness mainly around the lower lip, and very limited movement of the jaw in case of a severe fracture. Another X-ray was taken for here an athlete. It shows fracture in temporomandibular joint, and especially in the carotid area. And the symptoms here: pain, swelling, and bleeding from the mouth, breathing difficulty, discomfort when they bite, jaw stiffness, numbness in face, and also sometimes a numbness in the gum, or there is some mobility in the teeth. Tooth injuries, as my colleague mentioned today, there is different types of tooth injuries. I will start with the first one, which is the crown with or without root fracture. So this is the most common types of dental injuries, and it can occur in different ways. I think the simplest one, we called it crown infractions. And in this type of injury, it requires no treatment, just to keep the injured tooth under observations, and you need to do vitality test. The second one, we called it crown fractures, and a line of treatment here depend on the severity of fractures. If, for example, the dentine is exposed, here a line of treatment can be composite filling, and if there is a fractures with the including the bulb exposure, we have to do root canal treatment, and then then filling with or without the crown placement. And this is also one periapical X-ray was taken in our department. It shows root fractures for one basketball player, and in this case, of course, extractions is indicated. The second one, we called it tooth intrusions, and in this type of injury, a tooth can be pushed partially inside a socket, and a line of treatment, you have to do repositioning of injured tooth, and then splinting for a tooth for 3 weeks approximately, and then or you can do orthodontic extrusions. And we recommend the treatment should be relatively quick to avoid bulb necrosis. Tooth extrusions. This is also a picture for one athlete received trauma in the Olympic Games in London. In this case, the tooth is partially extruded outside the socket, and the line of treatment of tooth repositioning, and then you need to check the occlusions. The tooth must be away from a bite, and then you need to use a non-rigid splint for approximately 2 weeks, and you have to check the vitality of a nerve or a bulb in order. If the tooth is not vital, then root canal treatment is indicated. This is the most dramatic type of oral injuries in sport, and in this type, the tooth is completely knocked outside the socket and the oral cavity. And as Dr. Mohammed mentioned today morning, the success of treatment depends largely on the length of time tooth outside the socket. I think the last case I saw it yesterday for one Tunisian player received trauma 2 years before, and he just came here to sign contract with one of the club, and we found after oral examinations the tooth it was mobile, and when we asked him about the reason of mobility, if he received trauma or not, he mentioned to us 2 years before that his tooth was completely knocked out. So this type of injury, it can happen quite often in sports. So how to deal with this type of injury? You need to hold the tooth from the crown, and please don't touch the root, and try to place the tooth in our safe tooth liquid. We have it in our kit, and if the liquid is not available, then you have different options. The first options is to try place the tooth slowly, pushing the tooth slowly inside the socket. If not possible, maybe you can place the tooth in the buccal sulcus. And the third option, maybe you can place the tooth in a glass of milk. And of course, you need to transfer the patient immediately to the nearest dental office. So now my questions to our colleagues from the clubs and federations, Doctor, how they should to respond to these types of oral injuries.
A couple of issues for Jonathan Moss to deal with here.
Messi à terre.
Ouais, Messi est au sol. De l'autre côté du terrain, Messi est blessé. Ah, il sait.
C'est au contact de Marcelo.
Might be filling or crown. So different types of oral injuries, but how our clubs and federations, Doctor, can respond to this type of injury in the field if there is no dentist available. So you need to follow these things, A, B, C, D, E. So first of all, you need to check the airway. Why to check the airway? Maybe you saw in our video there is some types of oral injury. It can be with maybe in oral bleedings, or maybe the athletes can swallow any foreign bodies like a tooth or crowns and so on. So you have to ensure the airway is clean, and also you need to check the breathing, circulation, disabilities, and you need to then examine the injured area. Also, you need to answer the following questions. You have to ask you some questions. For example, how did the injuries occur? Because sometimes if if you know the locations of the injury, that might guide you to maybe some injuries in the other area. So, for example, here, this picture, it can show you athletes received a trauma to his chin. And by clinical examinations, you can see crack or fractures in the upper premolar area. And what you need to do, just try to use the dental instrument which is available in our kit, and you have to check the teeth. Also, where did the injury occur? Because that will give you sometimes an indications about the wound, if it's contaminated or not. When did the injury occur? As you know, sometimes the time is a critical factors, especially in case if the tooth is knocked out or in case of tooth displacement. Was there is a period of any consciousness? If so, then for how long? And is there is any headache, amnesia, nausea, or vomiting? These are all are signs of brain concussions which require medical attentions. Also, you need to know or to ask yourself, is there is any disturbance in the bite, because that will sometimes will help you or will guide you at that might be any other types of fractures, not only a tooth or fractures or crown fractures. It can give you sometimes indications of jaw fractures or temporomandibular joint fracture or alveolar also fractures, or sometimes also tooth luxations. Is there is any reaction in a teeth to cold and or heat? As again, that will give you also an indications or informations about dentine exposure. Usually when you have crown fractures, if the dentine is exposed, the tooth become highly sensitive, sometimes with a pain. Finally, also you need to review a medical history for your athletes. You need to check if they have any allergy, blood diseases, and any other informations which could influence the treatment. Okay, now how to diagnose and or the clinical examinations. So you need to do two different types of examinations. Examinations to soft tissue, and you need also to examine the hard dental structures. Examinations to a soft tissue should include inspections of a soft tissue wound, and if that present, a line of a treatment depend on a nature and the extent and the contaminations of lesions. So the nature of an injury can be abrasions, lacerations, or tissue loss. Wound cleaning or cleansing of a wound, you need to use the sterilized gauze that we have it in our dental kit, and just take some saline and try to clean the wound in order to remove or neutralize the contaminations to avoid infection. And also, if the wound is quite deep, of course, the suture is indicated. And remember, please, to give the patient antibiotics in the following cases: when the wound is heavily contaminated, and also if the line of the wound treatment has been delayed, for example, more than 24 hours, and when the general defense system of a patient is compromised, like in case of diabetic patient. As we know, our athletes, they travel quite often during summertime to prepare for the new seasons. So you need, please, to follow this guideline, and in case if they receive any trauma and there is no dentist available. Then a hard tissue examination. You can take the also light, we have it in our dental emergency kit, to check if there is a crown infractions or crown fracture. And what you need only to do, just you have to apply the light parallel to the lingual, you need to apply the light parallel to labial surface or buccal surface of the injured tooth. Again, you can use the sterilized and or non-sterilized gauze that we have it in the kit to check tooth mobility, especially in the axial directions, because that will give you indications of a severity of a vascular supply. And keep in your mind, and if there is groups of teeth, if there is a group of teeth mobility, that might give you also an indications of fracture, of alveolar process. Percussion testing. So again, take the dental instrument that we have it in the kit, and to check or to do percussions for the injured teeth in two different areas. So you need to do percussions in the axial directions and labial or buccal direction or surface. If the tooth is tender or respond highly to axial directions, then that will give you indications that might be damage to the periodontal ligament. And in case of percussions to a labial surface, and if there is high tone, then that also give you an indications of lateral luxation. Sensitivity testing, that will give you also informations about neurovascular supply. Also, we placed in our kit some cotton palette. So what you need, just maybe take the tweezer and take a piece of the cotton palette, place it in the cold water, and check tooth sensitivity or response of a tooth. That will give you also, again, indications if the tooth is vital or not vital. I think based on all of these things, we should to understand how is the dental emergence kit is important in the field in case if there is no dentist available. We have done last month workshop for our colleagues from the clubs and federations doctors. And the workshop was include presentations about the oral injuries, types of oral injuries, and also demonstrations. And we have done also hands-on training for them, and in order to ensure that they are confident on how to use the materials and the instrument that we have it in our kit. So the question is how to minimize a risk of oral injuries. You need to maintain the availability of the dental emergence kit. Use a mouth guard, especially in contact sports. We have to do a regular screening because, as I mentioned before, by our screening, we always protect them from any further complications or oral injuries, as we providing for them immediate preventive treatment. Then, of course, improve oral educations. Finally, you need to remember, please, the Academy of the Sports Dentistry recommend the use of the mouth guard in the following types of sports. Thank you very much.
We have time for one quick question from the floor, if anybody has a question.
It's not a question, but maybe to ask you why in this event not discuss the chronic damage in the sports. That is mean I mean exactly the TMG disorders that happened in the sport because they have so much clinching on the tooth during exercise many times. And in my clinic, I have many of sportsmen in all kinds of sports have this problem. And this make pain for around all of the facial pain and in the temporal and in the neck. Why not discuss in all events?
First of
Thank
all,
you.
Thank you very much for your suggestions. And I think we discussed this types of injury in our previous event. And we focus more on that part of injury. And Dr. Talal, I think he's the one who was talking about it last time. And also was with us Professor, the one from Kuwait, Larson. He's the one also who was talking about this type of injury. So we need to change. Any more questions, please, or suggestions?
I'm afraid that's time for all questions, Dr. Mohammed.
Thank you very much.